Do you need a breast reduction? Let's talk about it. Here are 5 signs that you probably need to see a plastic surgeon about getting a breast reduction. Number 1, you have breasts. You have breasts. No, but seriously, you have large breasts. And it doesn't need to be a particular cup size. You don't need to be wearing a G cup, although that is a huge cup, right? To be able to qualify for a breast reduction or to be able to see someone about getting a breast reduction. But if you have large breasts and they even pull you forward and make you a little bit hunchback, then that's a pretty good sign that you probably need a breast reduction. Number 2, your breasts are so big. This reminds me of Yo Mama jokes. Your mama is so big. Your breasts are so big that you have back pain. Not a great joke. No, it's not fun, right? So if you find yourself with back pain, then that's a pretty good sign that you need a breast reduction. Number 3, and in line with that, you have neck pain. Your neck hurts, probably because you're being pulled forward because of the way that your breasts hang. So back and neck pain are 2 great qualifiers for insurance to be able to pay for a breast reduction. And so, again, you probably need one. Number 4, you have tried things like working out, losing weight, even physical therapy for your pain, and it's not getting better. And probably your breasts haven't changed either. The biggest misconception is that losing significant weight will mean that you also lose significant breast tissue. Now, while that is true to some extent, that's a huge misconception. Breast tissue may feel like fat, it may even look like fat, right? But it's actually breast tissue, not fat. So it will not behave like fat and melt away when you've lost pounds. Now, people who have massive weight loss also have massive amounts of fat in their breasts, right? And so when they lose all of that weight, they do end up with breasts that are kind of deflated looking. But again, losing weight does not equate with losing breast tissue. The other thing is, if someone suggests to you, try physical therapy. Physical therapy is not anticipated to be the answer usually. I will even tell patients, hey, try physical therapy. And it is not that I think that it is the answer, but rather because insurance is really finicky about how they dole their money out, they want to see that you've tried everything you possibly can before a breast reduction, right? And so sometimes to be able to say to insurance, hey, look, she's tried everything, she's got the symptoms, pay for her surgery. Physical therapy may be a temporary solution and or a test in order to see if you actually need surgery. And most women who come to see me for breast reduction definitely do. The 5th sign to know that you may need a breast reduction, and that is you feel extremely uncomfortable in your clothing because this is so big, right? And the clothing fits in a weird way to you. And as a result, you also may have a little bit of social anxiety around. Conversely, here's a sign that you shouldn't wait. Me telling you, don't wait, okay? But no, seriously, I have patients who come to me saying, hey, I'm gonna have kids, and when I'm older, should I get the breast reduction now? Absolutely, right? You should understand though that your breasts will probably regrow after having kids, after gaining weight, things like that. And so it may be that you need another breast reduction in the future. However, dealing with back, neck pain, uncomfortability in your clothing for years and years is not a sacrifice you need to make for some kids you don't even know yet. They may not even be worth it in the end. Oh no, not worth it in the end. Oh, that was a bad joke. But anyway, the point is, we make a lot of sacrifices as women, and our health usually is one of those, right? But years and years of pain is not the way to go because you think that maybe one day or when I get married, I want to have kids. That's not the way to go. If you're planning to have a kid in a year, maybe, then yes, probably just wait until you have the kid. But if it's something that's kind of a long off goal, you're a teenager for one, it's not worth it to live a life where you are in pain, okay? Excuse the bad joke. Kids are always worth it. Okay? Any questions or comments, please leave them below. And subscribe, please. And as always, love you lots, and bye for now.